Good afternoon and welcome back to GP Video Podcast by Nadia. Today I'm going to tell you again 5 more facts about type 2 diabetes mellitus. So yesterday I told you about top 5 facts and now I'm going to tell you about 6, 7, 8, 9, 10. So what is diabetes mellitus? I've told you so many times. Type 2 diabetes mellitus is a condition which is characterized by increased blood sugar levels because our bodies are not able to respond effectively and efficiently to the insulin produced by the pancreas, which is supposed to lower down the blood sugar levels. And this high blood sugar level actually causes all the complications in the body. So top 5 facts that I told you yesterday were: it is the most common type of diabetes. Number 2 was being overweight increases your risk of type 2 diabetes. Number 3, you can develop type 2 diabetes at any age. Number 4 was type 2 diabetes mellitus often presents without symptoms. While number 5 was diabetes mellitus is mother of all diseases, is a risk factor for many diseases and health complications. Today I'll tell you about number 6 first. Diabetes is the leading cause of blindness and amputation in adults. One is more prone to develop early onset cataracts and glaucoma when somebody has type 2 diabetes mellitus. There are also long-term effects of diabetes on retina, which can lead to blindness. Amputation is another major complication of the disease and results in death for 30% of Australians with diabetes. So diabetes mellitus, as I said, is increased blood sugar levels. You would be thinking, okay, what does that do? That actually facilitates all the pathogenesis, all the pathological processes in the body. So leading cause of, so when you have diabetes, when somebody has type 2 diabetes, you have to be very careful about all your end organs. If you do not control your type 2 diabetes mellitus, then your liver, your kidneys, your heart, your eyes, your nerves, everything is going to be compromised, your vessels, everything. So just imagine, that's why it's called mother of the diseases. Fact number 7 is, with type 2 diabetes, you are 4 times as likely to develop heart disease. So diabetes is considered one of the biggest risk factors for heart disease, and 7 in 10 people with type 2 diabetes mellitus will die of cardiovascular disease if they do not look after themselves well. If somebody has diabetes, they also develop heart disease 10 to 15 years before someone without diabetes. So a diabetic develops heart disease 10 to 15 years before somebody who is not a diabetic. That's because the blood vessels are more vulnerable to risk factors such as high cholesterol and blood pressure. So diabetes makes your blood vessels more vulnerable to high cholesterol and high blood pressure. So that is why anybody with type 2 diabetes is more at risk of developing heart disease, and develops heart disease earlier than the normal population if they are supposed to do it. I mean, if somebody is supposed to develop, let's say he has high blood pressure and high cholesterol, but he doesn't have diabetes, he will still develop some heart disease at some stage. But the one who is a diabetic plus high cholesterol and high blood pressure, he will develop that similar heart disease 10 to 15 years earlier than the person who's not diabetic but has high cholesterol, has high blood pressure, but does not have diabetes. So diabetic patient has to be really on his toes for managing himself. Number 8, one will have at least 2 times the medical costs of someone without diabetes. So while diabetes costs the developed countries or healthcare systems billions of dollars each year, the costs for individuals with diabetes is also quite significant. This one that I have in front of me is from Diabetes Canada. It says 57% of Canadians reported not being able to adhere to prescribed treatment because of the high cost of medications, devices and supplies not covered by a health plan. Whilst that is not the situation as such in Australia, but still, because Australia has got the best public healthcare system, but still the medical cost of someone without diabetes is still at least 2 times the other people. Number 9, there is no one strict type diet for diabetes. So when you have diabetes, there is no particular meal plan you have to follow, but we should just try and fill our body with healthy choices, paying attention to portion sizes and meal scheduling, obesity, decreasing obesity by medications or by any means to help keep our blood sugar levels in check. So some good options include plenty of vegetables, fruits and legumes, as well as low-fat dairy products, healthy carbs like whole grain breads, and good fats, example olive oil and avocados. And also we can talk to a dietitian for that as well to guide us more, or a diabetes educator. Number 10, you cannot cure type 2 diabetes, but you can prevent it, and once it's happened, you can manage it. So in my next podcast, I will talk about diagnosing type 2 diabetes at the very early stage or even before that, and how can we do that, and how can we be able to prevent it to a large extent, and once somebody has been diagnosed with it, how can we manage it well. So unfortunately, there is no cure for this lifelong disease yet, although researchers are working on it. In the meantime, by managing your blood sugar levels and sticking to a healthy diet and lifestyle, one can reduce risk of diabetes related complications. For example, weight loss of just 7 to 10% of our body weight can reduce our risk of type 2 diabetes in half, risk of all the complications. Because itself, type 2 diabetes is what? It is about all the complications in the body. It is about complicating all the organ functions in the body. Catch you tomorrow.